Hello, I'm Don McGann, and I'd like to talk to you right now about a functional shift of the jaw to one side or the other. And I have a skull here to try to illustrate this. And right now it's in a class 1 position, right and left. I was looking there for a minute. Now, if I twist this mandible to the side, it's going to create a class 2 on my left side here, and it could create even a class 3 on the right in a severe case, okay? Now, it's all because of the jaw going to the right. That is different than if the upper arch is asymmetric, the right is further forward than the left, or if the lower jaw and teeth. If one side is further forward than the other side, it looks the same. So how we determine this is by taking like a frontal ceph to confirm that the jaw itself is shifted to that side. Now, why is it like that? Well, it's like that because the patient is biting somewhere, trying to avoid an interference, and the jaw can't center. It wants to be shunted to one side, usually a posterior displacement on the class 2 side. This is something that is very common. I would say in the cases that I get, which is weighted more towards asymmetry cases than probably in the normal population, I see maybe about 20% of the cases that I consult with that have a functional shift of the jaw that is either suspected, meaning that there's not a frontal ceph, or is confirmed, meaning that it does have a frontal ceph that shows that the jaw is off to one side. Now, the trick on this is not to diagnose extraction on one side and all that kind of stuff which you see in the orthodontic profession, but to find that interference in the bite that's making the jaw shift to one side, focus on that, and then give a little help with some unilateral elastics, and the whole thing shifts back, it centers, and now you've got a non-extraction, very nice result. We've done this on many, many cases, and we've seen it. We have several of the progressive aligner cases that you're going to see where this has been done, taking a unilateral 8 millimeter class 2 on one side and a class 1 on the other, and all of a sudden it's class 1 on both sides. And you go, what? How is that possible? Well, it's possible only through diagnosis. It's possible only through the technicians knowing what you're talking about when you say, do not shift these teeth off to one side and the other teeth off to the other side, messing up the midlines in the process and throwing off the whole bite. Instead, they know what you're talking about, and instead they have a way to shift that jaw to make what you want, and then you tell them to work on those teeth that are causing that shift in the first place. Okay, it's rather complicated actually, and it's the reason why I get a lot of these cases for mentoring and consulting. Now, I have been so frustrated trying to describe this to various companies in trying to get the aligners. And they're trying to get the midline right, but the answer to the midline is not shifting the teeth over. The answer to the midline is shifting the whole jaw, leaving the tooth where they are. Hard concept, especially if they're not trained, to understand that. The only company that I have worked with that knows what we're talking about is like Progressive Aligners, and I have described it through hinge axis shifts, both upper and lower are symmetrical, don't change that, all these little descriptions trying to get them to do it. But I can tell you that it all comes down to the training of the technician, so they understand what we're talking about, and then they make the right adjustment in the aligner setup And guess what? It works. You'll see it. Come and join us at some of the educational cases. And once you see it, you'll understand. Keep them coming. Don McGann.